COVID, monkeypox, polio. But why are we still talking about polio in 2022? After saying good riddance to polio for nearly 15 months, Pakistan reported its first case again in April, having detected only one case last year. Fast forward to August, we now have an alarming 14 cases being reported. Contrary to the government's claim that the polio virus was restricted to southern Khyber Pakhtunkhwa districts earlier, environmental samples from 7 cities have returned positive, indicating the presence of the virus in major urban centers. The virus was also reported in sewage samples collected from Islamabad and Lahore after a gap of 16 months. Both cities were declared polio-free in March 2021.
At the moment, it is the North Waziristan, which is the main epicenter of the outbreak which is going on in the South KP. And the environmental samples, recently we have detected virus out of South KP in Lahore, Islamabad, Rawalpindi, Nowshera, Peshawar and Swat, alongside with Bannu. But if you ask me, I think the place which is highest at risk from the virus is Karachi, because there is a higher populations of people from the South KP which are residing in that area. So the risk of virus getting there and spreading there is highest as compared to Lahore, Islamabad or Rawalpindi.
As Pakistan celebrated its first anniversary of being polio-free, a resurgence was brewing.
The people are moving back to the Fatah area, North Waziristan area, after the operation that was against the terrorists. And now, because they are moving in, the area that was not fully covered is showing the impact of kind of vacuum that vaccination wasn't able to reach. And it also tells us that our surveillance is going very well, and it is catching our weak points and is telling us that how we can get onto it and try to restrict its movement and eradicate it as soon as possible.
The highly infectious disease mainly affects children aged under 5 years. It enters the nervous system and causes paralysis and even death. Till we learn how to completely wipe out polio from our region, the need of the hour for Pakistan is to find ways to prevent polio from spreading.
The 3 steps that must be taken and are being taken are that we collect data of the environment, and that is coming positive. Environment means the polio is surviving in your area. So we then map out where we need to target. 2, we need to do mop-up operation by bringing in OPV, oral polio, to all the children in that area. An extra dose, 2 drops, as much to extent of people that are in that area. Now those areas mapped out recently. And then 3, that we try to get the routine immunization, that's essential immunization, working and full. All the children must get their routine vaccination, and that adds up to their security against the polio virus.
With 99% of the world now polio-free, Pakistan and Afghanistan are the only 2 countries in the world still living with this incurable disease. One case was recently detected this month in New York, which sent the entire United States in a frenzy. So is our government taking the necessary steps to curtail the spread of the virus in time?
As far as the polio program is concerned, we have a plan. We are improving we have re-strategized our vaccination campaigns. We are giving incentives. My frontline workers are very dedicated, and I'm sure they will improve the quality of the campaigns. the commitment of government, both the Prime Minister as well as the Minister, is of the highest level. Last week, the Chief of Army Staff, General Qamar Javed Bajwa Sahab, also visited operation centers and gave his assurance of full support. So while we are doing all these things, we are starting a polio campaign again in South KP from 15 and the rest of the country from the 27th. It is up to the community to make sure, to ensure that every child under the age of 5 years is vaccinated.
Polio is not curable, but it is a preventable disease with vaccines. Without a strong commitment by our government and citizens, our nation and our future, our children are still remain at risk from a vaccine preventable disease.